In Walmart's Newville, time was ticking away. Only a few nights left till the big holiday. But last-minute gifters had no need to worry. Walmart Express Delivery got their gifts in a hurry. From Nintendo to Nespresso and Lego flowers, they could check off their lists in as fast as an hour. All of Newville, East, West, South, and North could order gifts up until 5 p.m. on December 24th. So this holiday, just do as the Who's do. With gift delivery this fast, they all gasped. From Walmart? Who knew? Subject to availability, terms and fees apply.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
This is Dr. Ted O'Connell with the Med Prep to Go Step 2 podcast. In this episode, we'll be covering 3 pediatrics questions. Just a reminder that all of these questions and many more are available at medprep2go.com. If you'd like to get involved in this project and learn how to develop questions for our online question bank, please contact me at ted.medprep2go@gmail.com. If you like what we're doing, please subscribe to the podcast, give us a like, maybe even a review, and tell your friends about what we're doing so that we can grow our audience. All right, on to question number 1. A 4-week-old infant boy who is blood type O positive is brought into the office by his mother because over the last 2 weeks, she has noticed that he has been looking yellow. He was born at 39 weeks gestation by normal spontaneous vaginal delivery with no complications to a 30-year-old mother who had regular prenatal care and whose blood type is O positive. The mother states he has been breastfeeding every 2 to 3 hours for 15 minutes on each breast. The infant currently has 5 wet diapers and 5 to 6 bowel movements with pale-colored stools per day. Vital signs are within normal limits. Physical examination is notable for jaundice from head to toe, with normal heart sounds and lung sounds, and a liver edge is palpable 4 centimeters below the right costal margin. CBC and liver panel results are as follows. Hemoglobin, 13.5, hematocrit, 40%, platelets, 145,000, and leukocytes, 4,500. Total bilirubin is 9 milligrams per deciliter, direct bilirubin, 7.2 milligrams per deciliter. Alkaline phosphatase is 600 international units. Gamma glutamyl transferase, or GGT, is 275. AST is 190, and ALT is 150. Which of the following is the next best step in managing this patient? A, abdominal ultrasound. B, alpha-1 antitrypsin level. C, Coombs test. D, intraoperative cholangiography. Or E, magnetic resonance cholangiopancreatography, or MRCP. The correct answer is A, abdominal ultrasound. This infant is most likely suffering from biliary atresia, a rare disease of the extrahepatic bile ducts of the biliary system. This patient has a hyperbilirubinemia resulting from obstructive jaundice from the post-hepatic blockade of the biliary system. Lab values that support this are the elevated alkaline phosphatase, GGT, and total bilirubin, with the majority of it being direct bilirubin. Signs and symptoms of disease tend to appear after 2 weeks and include jaundice, acolic or clay-colored stools, darkening of the urine, and hepatomegaly. These patients are also very susceptible to fat-soluble vitamin deficiency due to bile not reaching the intestines to allow for digestion and absorption. Treatment is a portoenterostomy, also called a Kasai procedure, with the caveat that early surgical intervention leads to better outcomes and less need for liver transplant in the future. 60 to 80% of patients with biliary atresia will eventually require liver transplantation. Indications for liver transplantation include complications of portal hypertension, growth failure, and progressive liver dysfunction. When biliary atresia is suspected, ultrasound is the next best step because it is an easily available, inexpensive, and non-invasive test that can assess anatomy as well as exclude other causes of obstructive jaundice. Answer choice B, alpha-1 antitrypsin deficiency level, is incorrect. Although some forms of alpha-1 antitrypsin deficiency can cause this presentation, and it is reasonable to order a level, the results will take time, and biliary atresia must be differentiated from other causes of cholestasis promptly because early surgical intervention results in better patient outcomes. Answer choice C, Coombs test, is incorrect. A Coombs test is used when assessing autoimmune causes of indirect hyperbilirubinemia. Answer choice D, intraoperative cholangiography, is incorrect. Intraoperative cholangiography can confirm a diagnosis of biliary atresia, but it is a very invasive procedure. Answer choice E, MRCP, is incorrect. MRCP findings in infants with biliary atresia include incomplete visualization of the extrahepatic biliary system. However, an MRCP requires sedation of the infant and should not be used before an abdominal ultrasound is obtained. Question 2. A 5-year-old boy is brought to the clinic for colicky abdominal pain that started 4 hours ago. He recently recovered from a case of parvovirus B19 infection and had been doing well until today. The patient has no notable medical history aside from the parvovirus infection and is not currently on any medications. Physical examination reveals a cropping of erythematous rashes bilaterally on the lower extremities. The joints in the knees and ankles are also swollen and tender to palpation. White blood cell count, hemoglobin, platelet count, and coagulation studies are normal. Urinalysis and serum creatinine are within normal limits. The patient is started on naproxen for pain control. Which of the following is the most likely disorder affecting this patient? A, cryoglobulinemia vasculitis. B, giant cell arteritis. C, granulomatosis with polyangiitis. D, IgA vasculitis. Or E, Kawasaki disease. The correct answer is D, IgA vasculitis. IgA vasculitis, formerly known as Henoch-Schönlein purpura, or HSP, is usually distinguished by its hallmark rash that develops into palpable purpura. Gastrointestinal pain and arthralgias are also common symptoms that accompany this disorder. IgA vasculitis is commonly acquired after a viral upper respiratory infection, but other infections such as group A streptococcus or chemical exposures can also precipitate the disorder. Renal involvement is present in 21 to 54% of cases, though this patient does not have evidence of renal involvement such as hematuria or elevated creatinine. Answer choice A, cryoglobulinemia vasculitis, is incorrect. Although cryoglobulinemia can present with palpable purpura and arthralgias, it is distinguished by its association with chronic hepatitis C infection. In addition, blood tests would demonstrate cryoglobulin accumulation at colder temperatures. Answer choice B, giant cell arteritis, is incorrect. Giant cell arteritis usually only affects adults, and more commonly women, over the age of 50. In addition, the patient would present with headaches and jaw claudication rather than a rash. An important distinction here is the fact that this is a large vessel vasculitis, while IgA vasculitis is a small vessel vasculitis. Answer choice C, granulomatosis with polyangiitis, is incorrect. Although granulomatosis with polyangiitis does affect children, this disorder is distinguished by its involvement with the lungs, kidneys, and nasopharynx, none of which are mentioned in this question vignette. In addition, blood tests would show C-ANCA, a key marker of the disease. Answer choice E, Kawasaki disease, is incorrect. Although this disorder does affect children and presents with a rash, the hallmark for Kawasaki disease is a prolonged fever of over 5 days. Remembering the mnemonic crash and burn also provides other distinguishing symptoms. C for conjunctivitis, R for rash, A for adenopathy, S for strawberry tongue, H for hand and feet changes, and B for burn, indicating a fever. The key learning point for this question: IgA vasculitis is a small vessel vasculitis that primarily affects children after an infection such as a viral upper respiratory infection. It presents with palpable purpura, arthritis, abdominal pain, and sometimes renal disease. The pathophysiology of this disease is IgA immune complex deposition in the capillaries. The diagnosis of this particular disease is usually clinical rather than through laboratory tests. This demonstrates the necessity of understanding common age groups affected, as well as hallmark associations when trying to distinguish between vasculitides.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed-sponsored jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Question 3. A 5-year-old girl is brought to the pediatrician by her parents for concern about a rash on her legs and buttocks, which began yesterday and has been progressive. The child also reports abdominal pain. Her parents also report that the child had 3 episodes of bloody diarrhea 3 days ago. Past medical history is unremarkable, and she does not take any medications. She is afebrile, and the remainder of the vital signs are within normal limits. On physical examination, she is noted to have palpable purpura on both lower extremities. Abdominal examination reveals diffuse tenderness to palpation that does not localize. There is some voluntary guarding. The left knee is noted to be swollen and diffusely tender to palpation. White blood cell count, hemoglobin, platelet count, prothrombin time, partial thromboplastin time, and liver function tests are all normal. A urinalysis reveals mild proteinuria and 5 to 10 red blood cells per high-powered field. Which of the following is the most likely diagnosis? A, erythema infectiosum, or 5th disease. B, hemolytic uremic syndrome. C, IgA vasculitis. D, Kawasaki disease. Or E, thrombotic thrombocytopenic purpura. The correct answer is C, IgA vasculitis. So this is another question about IgA vasculitis. IgA vasculitis is the most common vasculitis in children and occurs less commonly in adults. It presents with palpable purpura of the lower extremities with at least one of the following diagnostic criteria: diffuse abdominal pain, arthralgia or arthritis, renal involvement, usually in the form of hematuria and/or proteinuria, or a skin biopsy showing predominant IgA deposition. Skin biopsy typically is not required, as IgA vasculitis can be diagnosed clinically in most cases. Thrombocytopenia and coagulopathy are not present. IgA vasculitis is a self-limited condition with a typical duration of 4 weeks. Initial treatment is supportive. Corticosteroids are indicated only for those with more severe disease, particularly renal involvement, such as glomerulonephritis. Answer choice A, erythema infectiosum, is incorrect. Erythema infectiosum can be identified by an erythematous rash on the cheeks and a lacy rash on the extremities. Palpable purpura and renal findings are not present. Answer choice B, hemolytic uremic syndrome, is incorrect. Hemolytic uremic syndrome presents with the triad of hemolytic anemia, thrombocytopenia, and kidney injury. The normal CBC in this vignette rules out hemolytic uremic syndrome. Answer choice D, Kawasaki disease, is incorrect. Kawasaki disease is one of the most common vasculitides of childhood, involving medium-sized arteries. A fever is the most consistent manifestation of Kawasaki disease. Kawasaki disease should be considered in all children with unexplained fever of 5 or more days duration. Erythema of the lips and oral mucosa, bilateral non-exudative conjunctivitis, extremity changes, and cervical lymphadenopathy typically develop after a brief, nonspecific prodrome of respiratory or gastrointestinal symptoms. Answer choice E, thrombotic thrombocytopenic purpura, is incorrect. This condition is rare in the pediatric age group, and the normal platelet count in this vignette rules out thrombocytopenia. The key learning point: IgA vasculitis is a small vessel vasculitis that primarily affects children after an infection such as a viral upper respiratory infection. It presents with palpable purpura of the lower extremities with at least one of the following diagnostic criteria: diffuse abdominal pain, arthralgia or arthritis, renal involvement, or a skin biopsy showing predominant IgA deposition. Thrombocytopenia and coagulopathy are not present in IgA vasculitis. That's the end of this episode, but please do check out our other episodes as well as all of these questions and many more at medprep2go.com. If you like the content of these questions, please check out the USMLE Step 2 Secrets podcast for more detail.
Hey, Ryan Reynolds here, wishing you a very happy half-off holiday, because right now Mint Mobile is offering you the gift of 50% off unlimited. To be clear, that's half price, not half the service. And Mint is still premium unlimited wireless for a great price. So that means a half day, yeah? Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. New customer offer for first 3 months only. Speed slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.